So welcome everyone, and thank you so much for joining us today. This is our first of the Diversity in Maritime webinar series for Maritime UK Week. And we're delighted, given that Saturday was World Mental Health Day, to be kickstarting the week, shining a spotlight on this really, really critical area. So a few bits of housekeeping that I'm very, very sure you've all heard to death, but we will just say, please do put yourself on mute unless you're talking. This is a bit of an in conversation with webinar, so we do want to make sure we are listening to you. You got a chance to ask your questions. Feel free to put them in the chat function, or if not, at the end there will be an opportunity for a bit of a Q&A. A bit different to our network meetings, we are recording this. So if you do not want to be on the recording, feel free just to turn your camera off. And just to let us know, you can send me a private message to Chrissy and we can make sure that your name is also edited out. The reason for this is we want to ensure this is a bit of an engagement piece. It will be available on our website along with our other diversity in maritime webinars. A final ask, I'm going to put some hashtags into the chat function. If you could share, if you're happy to share that you're part of this dialogue today, we just ask you to use the hashtags Maritime UK Week and Diversity in Maritime. So without further ado, I'm going to hand over to Stu, who is the chair of the Mental Health Network, and he will be chairing today's webinar. Thank you.
Thanks, Chrissy. Welcome, everybody. I know that this is a subject that everybody on the call is passionate about. What we are trying to do with the mental health group is to raise its awareness, provide an area where people can feel free to speak up and be available to make that call, all in relation to mental health for all. I'm going to introduce everybody to the panel that we have got with us today. We have Verity from DP World. We have Graham from Shipping Exchange. We have Mary from JG Maritime Solutions, and Caitlin, who is the Deputy Chair and also from ISWAN as well, part and parcel of the panel as we go through. Before we make any starts, I'm going to ask them to introduce themselves. I'll start with Verity, please.
Good afternoon, everyone. I'm Verity. I work for DP World, specifically the port in Southampton. I'm an HR business partner. I've been with the port for approximately 4 years, and I coordinate the Wellbeing champions at the port, and I also have a personal interest in mental health as well, which is why I'm here today.
Verity. Thank you, Verity. Graham.
Good afternoon, everyone. Thanks to Maritime UK for this opportunity. It's really good to be here. A little bit about myself. I'm an ex-seafarer. I was at sea for 5 years. I worked in oil, chemical and gas sector primarily, and I moved ashore at the beginning of the year. I'm a council member with Nautilus International, and I also run a maritime startup called the Shipping Exchange. And a large part of the reason I moved ashore was down to mental health. So it's great to see so many people here engaging with this discussion.
Thank you, Graham. Mary.
Good afternoon, my name's Mary. I work for JG Maritime Solutions. I was a seafarer for 11 years, during which time I suffered mental health issues myself. So it's something I'm very passionate about. Haven't been at sea now for about 15 years. I've been working in the training industry, and I've just recently come back into the maritime industry.
Thank you, Mary. Caitlin.
Hi, I'm Caitlin. I'm the project manager at ISWAN and the vice chair of the Mental Health and Maritime Network. The main focus of my work is, in terms of mental health, is looking at what improvements we can make specifically for seafarers and the particular challenges of being at sea. On the one hand, the vulnerabilities or the issues at sea that can exacerbate issues, or maybe the cause of poor mental health sometimes. And then the fact that access to support is a lot more difficult for seafarers. But in terms of my role on the network, which is looking at the whole of the industry, I am really happy to be part of that, because I see it's really vital that everyone in the industry is comfortable talking about mental health, and has increased awareness about the issues, about understanding of mental health, because we all have mental health, and we all may find ourselves in need of support or have the opportunity to be able to provide support to someone else. So I'd really like to be part of this movement, to be able to ensure that we're making big improvements to the support that's out there and the accessibility to enhance everyone's understanding about mental health.
Thanks, Caitlin. So today's session is all about mental health for all. It's about you, and it's the engagement with others. It's about breaking those barriers and identifying ways in improving mental health. So it's all about, today is stigma and resilience. I'm going to ask Graham to kick off this discussion point on stigma. So Graham, how are we breaking barriers down?
Thanks, Stuart. Yep, so I think the issue of stigma and mental health is that they unfortunately go hand in hand across all industries. And if we look to what the actual definition of stigma is, it's where it views you in a negative or a discriminatory way based on a perceived characteristic or trait. And in this case, it's a mental health issue that you might have. If we think about the shore-based sector of our industry and other industries as well, around the world, there's been a whole host of research projects that have taken place, and it shows that almost 38%, 40% in some instances of people who work ashore suffer from some form of mental health issue every year. And if we put that into the context of our maritime sector, we have seafarers who are working away in some of the most demanding environments in the world for prolonged periods of time, away from friends and family. And in recent weeks and months, we've seen the pandemic has really put the spotlight on this problem. But the task of breaking down stigma, in my opinion, it's multifaceted, and unfortunately, it won't happen overnight. It will take generations to change, but there is a lot that we can do, both as individuals and as companies, to try and make some inroads into improving mental health within the industry. So on the one hand, I feel that there is a significant lack of dedicated maritime research and studies. And on the other hand, we have the age-old issue of people either dismissing the topic altogether or being slightly on the fence as to whether it really matters because they haven't experienced it themselves. If we think about the first point that I made, it's human nature to challenge things that we don't understand. And particularly as adults and educated professionals, we don't like doing things when we don't know the reasons why, whether that's the benefits to it or perhaps the negative connotations that it might have. And because we have a lack of maritime specific research, it's difficult to make a compelling case for people that don't view mental health as a priority without being able to show them what benefits can be, or what benefits can be made if we invest our personal and financial time into this problem. It's often said that it costs too much to make these changes, but that's not necessarily the case. In fact, I disagree quite strongly with that statement. If we look at how much it costs the UK economy ashore alone every year, it's an exponential amount of money, and there's no reason why that isn't the case within the maritime sector. Regarding the second point I made about whether mental health is viewed as a priority, I think it's a sad realization that in our sector, it's a very real issue. And the first and biggest step in changing that is acknowledging that it's a problem, even though it might not impact you directly. And I think the fact that we're all here, we've all made that step together. And that doesn't just relate to only this sector, this network within diversity in maritime, but all of the networks within diversity in maritime. if we try and map the causes and consequences of mental health at sea, it's incredibly difficult. You have an environment where honest reporting is significantly dictated by the environment in which you work, whether you have approachable senior officers, whether you have friends on board, whether you have the adequate internet connectivity, but not just at sea, also ashore, whether the company which you work for is committed to mental health, whether you have adequate management systems in place. For example, who do you go to ashore if you have a mental health concern, either for yourself or for one of your colleagues, if you don't feel like you can raise that issue on board? And it's one thing being open. Sorry, I'm just trying to get my thoughts together. To put some context to this, I sort of will share a real world example from myself, and it's not something which I've ever done on an open forum. The reason that I came ashore was down to mental health, and for a less of a word, I was quite badly depressed when I was at sea. And I remember driving to the Isle of Grain, where I joined a vessel towards the end of last year, and this overwhelming feeling of dread and almost impending doom on the way because of personal circumstances which leading up to that deployment, I was not in the right frame of mind whatsoever. For the first month, a little bit over a month, I tried to keep my head down and power through. But as time went by, I became more and more aware of the fact that I was struggling to maintain my focus, to sleep, to exercise, and it could have had serious implications if I was not focused whilst on watch. And I decided that I needed to speak to someone, and I went to the captain, and who was honestly fantastic. He was nothing but supportive. He put me in immediate contact with the relevant individuals ashore within the company, and the structure was in place, and the company had spent clearly a lot of time and energy investing in this area, so that when somebody flagged a concern, the necessary contingencies were there to support them. And that was nothing to do with the flag of the vessel or the nationality of the senior officer I went to. It was because they recognized as a person the importance of mental health, and the company also recognized how important it was to address these concerns. And as a kind of final thought is, how do we break down these barriers? We need to be prepared to share experiences like this, whether that's as an individual who's gone through something which others might be able to relate to, or whether that is the company being aware that these things take place and not praising it, but saying, look, we know that mental health is a problem. We have had our employees come to us and we have supported them. How have we supported them? Why do we support them? And by creating that environment ashore where mental health is taken seriously, that will eventually in time translate to the environment at sea. And we need to showcase what companies are doing. And there are a lot of good companies out there. And I'm happy to say that the company I worked for was TK Gas, based up in Glasgow. And yeah, so I'll move on to somebody else. I'm conscious that I'm talking too much now, so thanks, Stuart. Well, I think you're on mute, Stuart.
Yeah, I was. Thank you very much, Graham. Great, thanks for sharing those real world examples and everything else. I'm going to bring in a couple of the other panel members to talk about some real world examples. But just before I do, I just want to touch on that honest reporting piece that Graham's mentioned. The real world example of that is by having these open, honest conversations with people means that we can get that support that is available within those organizations. Just to give you an example of the support that is available that we use, we have CBT, we do have clinical hypnotherapy support, which is slightly different to the CBT if people are suffering from any type of mental issue, a mental health issue, and that side of things. Verity, have you got some real world examples of breaking down that stigma?
Yes, of course. Thank you, Stuart, and good afternoon, everybody. If I talk a little bit about our port first, to give you some context. So the majority of our workforce are men, and 59% of our workforce are over the age of 45. So we're certainly not in a position at the moment where we can rely on the younger workforce who are happier to have these conversations to help break down the stigma. I count as part of that 59%, I'm ashamed to admit, but I certainly remember earlier in my career, the news stories talking about schizophrenics committing horrible crimes, and if anyone had a mental health issue, it was kept very quiet because they're worried about losing their jobs or not being given a mortgage. So that's the backdrop of a lot of our staff in talking about mental illness. Talking about males as well, as we all know, they're less likely to talk about mental health compared to a female. And we also know that about 1 in 4 people experience a mental health problem at one time or another. So this means in our port, we firmly believed that at one point, mental illness was hidden and certainly underreported when it came to sickness absence. And the likelihood was it was masked by being reported as coughs, colds, etc. and so forth. So we had to be able to start these conversations, as Graham mentioned, to start breaking down the stigma and people to start being more honest so we could give people the right support. We also know with males, they're more likely to turn to drink and drugs instead of talking about their mental health, which added another layer of concern that we had in terms of mental health. So what did we do? The first thing we did is we signed up to the Mental Health Pledge, and we deliberately chose a member of our executive and the union convener. And we made sure there was very widely publicised what we did, because there was a firm message to staff from our trade union and from our executive lead that mental health was being taken seriously, and to start that open culture that let's start talking about mental health. We followed that by well, it started a conversation, should I say, and 4 individuals came forward to record their stories on video, which was shown at our safety and skills training days, which our terminal operators and engineers do once a year. By showing real life stories of people on our terminal who had had mental health issues and how they overcame them, increased the frequency of the conversation. On top of that, about 2 years ago, I launched a network of Wellbeing champions, and they also were there to be the ambassador to the organisation to facilitate these open conversations as well. So with that, with brave individuals coming forward to tell their stories and people seeing the reaction of other people, which was it's okay to have those conversations, and also that these people didn't receive any negative feedback, that it just starts to crack open the culture. And then after that, it's been regular messaging with campaigns such as Time to Talk, keep repeating it's okay not to be okay, and even simple things like just ask your colleague if they're okay, if they're kind of starting to act a little bit out of character or they seem a bit down. So it's just normalising mental health conversations, and it's just, again, just making sure that everyone is comfortable in having those conversations, and whether they're small or big. I mean, my personal experience in the terminal is I could just be having a very innocuous conversation with an individual about something I've seen at the cinema. And because they feel comfortable, all of a sudden they're disclosing a mental health issue to me. And at the end of the conversation, they'd say, I don't know why I told you that, but it's about making that person feel comfortable. So they're not, let's have a conversation about mental health. Let's try and come at it from a different angle to kind of set the scene. Yeah, so that's kind of how we did it at DP World, and we're just continuing that process and just keep the messaging going, particularly with Mental Health Day on Saturday. We actually told a story of somebody and how they experienced mental health as well, which also people start to understand how it feels, how that person experiences it, so they can put themselves in that person's shoes to say, oh, that's what it means to have a mental illness. So those are the main things that we did on the terminal to help start to build that conversation.
Brilliant. Thank you, Verity. Caitlin, do you have a real world example that you want to share, please?
Yeah, I mean, I think everyone's got loads of really interesting, specific insights. So I'm not going to talk for too long, but just to give you a kind of overview in terms of how ICE1 has tried to provide useful resources for seafarers specifically. We started off with improving our health resources. Really, we've had a number of health resources for a long time on various different types of health issues, but our mental health section really needed updating. It's very prescriptive and really sort of told seafarers what they already knew. It was really useful at the time, but as time has moved on, we just realised that there was so much more that we could communicate to seafarers, looking at ways that you can I suppose prepare for your time at sea, and looking at positive psychology and the fundamental principles of people who are thriving, flourishing, and what you can do to protect your own mental health. Now that obviously alone doesn't work if you're working on board a ship that has an environment that is not conducive to good mental health. So we've also been working with shipping companies as much as possible. And, you know, I think, like Graham says, there are some really great shipping companies out there. But part of the usefulness of self-help resources, the ones that we've been providing, and the ones we've seen real results from, really great feedback from seafarers across the board, around the world, of different age groups, is because on the one hand, that those barriers that we need to break down, they're still very much present for so many different reasons. And sometimes looking at self-help is the first step to being able to get the confidence. If you don't have the support from a company, you're not working in an environment where you feel you can have these conversations, sometimes those self-help resources, as well as providing useful tools for being able to build resilience, or other terms for improving your own psychological well-being, then that's when it can be really useful. And the other really important part of our work around just to sort of complete the circle really is access to support that I mentioned before. We have a 24-hour helpline that we also highlight the importance of there being support available to seafarers, because they are far from home, they're far from their usual support networks, and connectivity can be an issue wherever you're working. So it's just making sure that as much as possible, seafarers can reach out and contact emergency support when they need it. I just want to touch on a couple of things. I know we're going to talk about training later, or it's important that we cover it, but I just, in terms of stigma and breaking down those barriers and talking about mental health in this very male environment, we need to sort of look at what the issues are, and when it's not over explicit prejudice in terms of talking about mental health, when there's a lot of environments where people might, especially companies or really well-meaning people, might claim that it's totally fine and safe to talk about it, but when people start to open up about their mental health, other people become uncomfortable, and people just don't know how to respond. And I think there's such a fear of the unknown there, and people, I think this is where training comes in, and where we just really need to increase everyone's knowledge of what mental health is, and as well as how best to respond to those sorts of conversations, as well as noticing as well when you might be concerned about someone. And although I said I wasn't going to talk for very long, I'm just going to say one more thing that just mention what Graham said about cost and companies not knowing whether it's worth it. It really, it's obviously there's a bottom line there, but it's just not rocket science that if your crew feel happy, supported and comfortable, they're going to be more productive, and it just definitely is worth it.
Okay, thank you, Caitlin. Just before I move on to resilience and that, we've had a couple of questions come through on the chat. Debbie will probably answer that one in the next part of the session today, and Sam, hopefully we'll capture those services in the next question as well. whilst those are two on the screen, one I do want to come back to, we had in as an early question is, what do you say to somebody with mental health issues? The panel was discussing that just before we came live. My way of looking at that is, well, you say hello to them like any other normal person and everything else like that. I'm going to pick on Graham. Could you respond to that question very, very briefly?
Yeah, it's a really interesting question. I like the wording of it. What do you say to someone with mental health? And like you said, Stuart, is absolutely no different from if they are not suffering from a mental health issue. And I think this is maybe part of the problem, that people view it as a label or a difference to what they perhaps deem as the societal norm or normal personality traits. And this is something that we need to kind of overcome. If somebody was carrying a lot of luggage at the train station with a broken leg, what would you say to them? You'd say, do you want a hand with that up the stairs? You know, and that barrier between the physical and the mental issue that exists in that person's life at that time is something that we need to try and create equality between the two. You know, so if you're aware that someone has a mental health issue and you're personally, you're good friends with them, and you're aware that they're at sea and maybe it's their wife's birthday or their child's birthday coming up in a week or two, try and remember little things like that if you're a seafarer, and just talk to them as you would a normal person, but in the back of your mind be mindful that the fact that they might be struggling more so than the next person. It's that simple. We need to create a greater equality between the physical and the mental.
Indeed. Okay, thank you for that. I'm just going to move on to resilience now. So we've had a question in earlier. Again, it says, for small organisations that do not have access to an OH provider, how do you suggest that they support their staff in mental health? I'm going to come to Mary for the response for that one. Mary.
Sorry, thank you, Stuart. I think in the first instance, employers, regardless of their size, need to be mindful that they have a duty of care to all their employees. So that includes their health, safety and wellbeing. If they don't have an occupational health referral system in place, I think the main advice would be to encourage them to seek medical help from their GP and medical assistance. There's a number of things that employers can do as well within the workplace. For example, like creating a positive environment so people feel comfortable having that open and honest conversation about their mental health and wellbeing. I think another thing they could consider putting in place would be a mental health champion. So employees might not want to go directly to a line manager, but then they seek to speak to and support from their peers in the first instance. So that could be another thing. Regular catch-up talks. I think sometimes we find that we're just too busy to talk to people. You know, you can go sometimes weeks without having a proper conversation and sitting down with an employee and saying, how are you? How's your week going? So I think that's a really important thing and beneficial as well. Mental health and wellbeing policies. So small businesses might not have all of the policies in place, or they'll only have what they need to for statutory requirements, but putting in place a mental health and wellbeing policy will focus and show the company's commitment to mental health and wellbeing, and also put in place a process that people can follow. And also looking at outside organisations, so people like Mind, there's a lot of guidance on their website as to how to support somebody who's suffering with mental health issues. And ACAS as well, from an employment law point of view, there's a lot of advice and guidance on there for employers. So yeah, I think that's about it.
Brilliant. Thank you, Mary. Verity, could you give us an example of what DP World have done from your approach, please?
Okay, so at DP World, we decided that the best approach would be a more holistic view to well-being as opposed to just focusing on mental health. And there's several reasons for this. There are plenty of examples of research out there which shows a clear link between various different elements of wellbeing and mental health. So, for example, physical activity is good for mental health because of the endorphins it releases. In terms of diet, I'm sure you've probably heard all of these. The type of food you eat can have an impact on the way your brain functions and the serotonin levels that your brain produces, which is the feel-good chemicals. On the other side of it, if you drink that has an impact on mental health in a negative way, but then it's a chicken and egg. You drink to socialize, and that can damage your mental health. On the other side of it, if you're mentally ill, you're more likely to abuse alcohol. So in terms of a holistic view, we decided to look at all the elements of wellbeing as opposed to just focusing on mental health alone. Hence why we introduced wellbeing champions at the terminal and not just mental health champions, because of the link. So what do we do as part of that? So yes, they're trained in mental health first aid, but also we do campaigns to help promote the other elements of wellbeing, such as Cycle to Work. We did Cycle September last month, and in our region we came second, so that was really good. We just did a campaign on losing 5 pounds, and of course, because the diet, as I said, also has an impact on mental health. So that holistic view helps to build the blocks to good mental health, as well as dealing with the mental health in itself. So that would be an approach I would advocate if you were looking towards tackling mental health. It's key just not to forget those other strands of well-being while tackling mental health issues as well.
Okay, thank you, Verity. Just want to circle back on some of the comments that have come in. Just going back to the conversation with what you say to somebody with mental health issues. Colin has just said that we do care for people. If you work for an organisation that cares and looks after their employees and everything else like that, they should have the same level of care as a physical injury and everything else like that. That's where we need to get all of our organisations on the same page there, and with the exec working in the same direction and that side of things. Laura, your comment on the training element. This was the discussion point from the last webinar where we had I've forgotten the gentleman's name, that's very remiss of me, who presented the mental health standard for the maritime sector. And people were saying, is there a standard? Isn't there a standard? And that side of things. There is something available. We can get that information across to you and make sure it's on the Maritime UK website for everybody to be able to pick up and have a read and that side of things. Caitlin, I was wondering if you could answer Anna's question of an update on MCA and the mental health assessments.
Yeah, hi Anna. I've just had a read. I can't really comment on the medical assessment part of the NG1. I know that it's a really controversial area. A lot of people have quite strong views about psychological assessments before joining a vessel, and that, you know, there are a lot of different views, and I'm not really the right person to comment on it or knowledgeable enough about the NG1 medical assessments when it comes to the mental health aspect of it. But I do know that the MCA are looking closely at mental health in their most recent work, and as part of this they've just released, I think it's in the test phase or a pilot phase, a wellbeing assessment tool. But I don't know if that we can definitely find out more information about that and about the goals for that to send on to you, because I'm sure as a training provider and someone that's very concerned about students and just other crew with mental health issues, and as you mentioned, any risks to themselves or other people, it's really important that you have that information. So I'll find out what I can and send it on to you.
Caitlin, thank you, Caitlin. Is there any questions from anybody else that they would like to know anything or ask the panel of anything related to stigma and resilience? Sophia, yes, completely agree that a mental health assessment for sea service would be very challenging because the variables are very, very different compared with just a shoreside work. However, if we can get something for a shoreside work, at least it's part way of doing something as well. Okay, so mental health first aiders, this has come up a couple of times. I believe, and I will go away, and I was meant to do it over the weekend, so I had it to hand, that the first aid at work regulations 1981, whilst that hasn't been changed, I believe that there is a requirement in the guidance notes that identifies that mental health first aiders is on the same level as normal first aid at work. I will dig that out and find it, and we'll share it with everybody that's been on this this call. It was mentioned by Carl Simons at the last meeting that we had at the last webinar. So we'll make sure that that gets issued to everybody and everything else like that, so that people are clear that, you know what, first aiders and mental health first aiders are on the same level. So we'll get that done. Whilst I'm talking about mental health first aid and everything else, in December, when we have our next webinar, Simon Blake, the Chief Exec for Mental Health First Aid England, will be part and parcel of our panel discussing that very subject, so we can make sure that that gets that fed into that discussion point as well. Thanks, Chrissy, for putting that in and everything else like that. I've got one last plea request. We issued a benchmark survey back in September, asking all of the organisations to complete that within the maritime sector. We have had some good responses so far. Out of the output of that survey, you get your own private report to say how you can improve mental health within your workplace. The survey is based on the Stevenson Farmer report, Thriving at Work, and it's the maritime sector, the highway sector, the aviation sector, and the utility sector are all using that same survey to measure how the sector and industries are working towards improving mental health. If we could ask you to complete that, that would be fantastic, because that means it'll give us a great idea of how we can focus and move forward, particularly in 2021, and give more the right kind of assistance and support that organisations are looking for. But it also means if somebody's doing something great, we can promote that, and people can hopefully lift it from that organisation and scale it to their own needs. So that's all from me. Graham, would you like to say anything more?
Just to expand on the question raised by, where's it gone now? By Patrick earlier about how far off, how difficult do we think it would be to get this introduced? I think this is where the responsibility for those forward-thinking companies comes into play, to really lead the way in showing the benefits of what the provisions that they have in place for that wellbeing support, such as DP World, to encourage others to consider doing similar as well. And just as a one sort of final point from myself is I primarily use Seafarer Help, which was they call the Lifeline for Seafarers, and that's through ISWAN. That was a free resource provided by my company, and I think it just shows just how much is available. I had regular WhatsApp messages and regular phone calls whenever I was in port with the advisors, and it was a fantastic service. So it shows that you don't have to spend millions or even tens of thousands of pounds within your own company, you can reach out to the pre-existing networks that are already there.
Thank you, Graham. Verity.
What I would say is you don't have to be a mental health first aider or an expert in mental health to help somebody. Just asking someone if they're okay is so powerful. I mean, I mentioned a story that we publicised last week at DP World about an individual with mental health issues. And just to kind of paraphrase the story, this person suffered with depression and anxiety. And when they're in the depths of that condition, it can get to the stage where they can't even form the words to ask for help. But just by someone approaching them and just asking if they're okay, and the only word they can say is no, for this person meant a lot, because it just cut through the negative thoughts that, that they were on their own and no one cared. So even just asking that one question can be so powerful and so helpful to someone. So that's what I'd say, is just don't be afraid to approach someone and ask them if they're okay.
Okay, thank you, Verity. Mary.
No, nothing from me.
Okay, brilliant. Caitlin.
Yeah, I think briefly to pick up on Verity's point, I totally agree with that, and it's something that really recommend as well. It's just because we've seen I've seen firsthand in some training sessions and working with shipping companies the reluctance of some crew to ever engage with conversations, even if they are approached, because of this worry of making things worse. And it's really unlikely when someone's feeling that low that any support you try to give can make the situation worse. So while I really I'm pushing for the whole industry to improve their knowledge in this area, it's really important. I hope it continues. I really support what Verity just said. You can always be there just to listen to someone, and that's sometimes the most valuable thing you can do.
Okay, brilliant. Thank you very much to the panel for spending their time, and I know there has been a couple of meetings just before we came live on today's session, so very much appreciated the time that you've spent helping us get today set up and everything else. I'm just looking through the messages. If it's okay with some of the people there, Colin, wouldn't mind having an offline chat about the resilience assessment. Sam and Penny, it'd be great to have a chat about the ENG1 and the mental health part to see if we can help or assist or move things forwards or give people a bit more clarity on those issues. So that might be the second and third items for December, if those people are happy. If you are happy, could you drop Chrissy just a note with your email address and everything else, and we can get that underway. Chrissy.
Wonderful. Well, I just want to wrap up the session and say a big thank you to you all for zooming in today, and to the fabulous panel. Thank you to Stu for chairing today, to Mary, Caitlin, Verity and Graham for sharing your story.